Hello, I'm Lori Steiner. Welcome to Golden Opportunities.
Today, as your age increases, does that mean your risk of cancer does too? We'll focus on the facts. Then we'll tip you off to the top tips to tackle your 2014 taxes. We'll open up about open enrollment for healthcare coverage and give you details about the approaching deadline. Plus, when should you intervene with your aging parents? We'll list the signs and situations. And we vow to share how married couples can benefit from Medicaid.
It's time to get GOing, so pull up a chair and join us at our kitchen table for Golden Opportunities. There are a lot of benefits to getting older. For example, more time to enjoy family and friends, develop hobbies and interests, and do what you want to do. But with age also comes challenges. Dr. Joanna Burrell is here today to make us aware of one particular challenge, the attempt to overcome the risk of cancer as you age. Dr. Burrell is the Associate Cancer Center Director for Clinical Research at MetroHealth. Welcome to the show.
Thank you.
So, how does aging actually affect your cancer risk?
Actually, aging is the strongest risk factor for developing cancer. And as we get older, our cells don't function as well. They're supposed to divide and share DNA with the next cell. And as that happens, as that process happens, they lose their ability to divide, and the DNA gets abnormal and damaged.
Ooh, mutations and things like that.
Mutations is the right word. And once there are too many mutations, you can start to develop uncontrolled growth, and a mass will develop, and hence cancer will develop.
So that's the cancer part. Now that's internally to our bodies. So are there also external factors that can affect our cancer risk in aging?
Environmental factors are also very important. So there are problems such as tobacco, any type of use of tobacco, alcohol, some viruses, exposure to the sun can directly damage the DNA in the cells and cause mutations. And then there'll be that abnormal growth of mutations that are out of control.
And the more you're aging, the more you're exposed to all of these things.
Absolutely, it is a cumulative effect.
Oh man. So if we do develop cancer at an older age, there are other factors too that come into determining the treatment, right?
There certainly are, and there's three main types of treatment for cancer care. So there's surgery, radiation therapy, and drug therapy or chemotherapy. The older we get, the more other conditions we have. So people develop diabetes, hypertension, heart disease. That weakens the body. So when you're trying to get these treatments for cancer therapy, your body may not be strong enough to recover from them. Also, it's important to be very mobile and active when you're undergoing therapy for cancer. And when we become older, we lose our muscle mass, we have more fat, we have arthritis. It's harder to be active and take care of ourselves. And that's extremely important in receiving treatment for cancer.
And all of these impacts, all of these changes in our body impact the ability for us to handle and live through the chemotherapy and other treatments, right?
That's exactly right. And sometimes the risk of getting sicker from the chemotherapy and other treatments outweigh the benefit that might happen.
Ooh, so that's a hard decision to be making.
It's a very hard decision, and people do have to face that frequently.
Okay, so, but I have heard that there's a lot of advances in the treatments, and it's not so harsh anymore.
Well, for instance, there's newer anti-nausea medications. So whereas nausea and vomiting was a huge problem in the past, the majority of patients may not have trouble with that. And also there's newer therapies, immunotherapies that are affecting the immune system. There's now chemotherapy that comes in tablets that you take orally. And those still have side effects, but it's a whole different range of side effects. And many of those can be better managed.
Okay, well that's helpful to know. So, but what's the best way to lower our age? Even though we're going to lower our risk of cancer as we age. We can't stop the aging, but what can we do?
So certainly the healthy lifestyle. So maintaining a good weight, being active, not stopping, or not smoking or stopping smoking, not drinking, staying out of the sun, will decrease our risk of getting cancer.
Also excellent information to know. So now we do know the risk of cancer increases with age. We can't change the fact we're getting older, but we can challenge our cancer risk by leading a healthy, active lifestyle. That's the best preventative medicine we have available to us right now. My thanks to Dr. Burrell for sharing this ageless information and advice.
You're quite welcome.
To learn more, call Metro Health at 216-778-7800 or visit www.metrohealth.org. Next, determining your deductions.